There are roughly 5 million nurses in American healthcare. They're not just part of the system, they are the system. So it should terrify you to learn that the system is collapsing.
Medical strikes are turning heads.
Research continues to show that nurses are feeling burnt out.
The numbers are really alarming. Nearly 100,000 nurses have recently left their job,
only making the existing nursing shortage worse.
This isn't happening by accident. There are 4 ways the healthcare system is actively failing its nurses. The first way is unsafe staffing ratios.
I was working in the ICU, and you're only supposed to have 1, maybe 2 patients in the ICU because the patients are much more sick. They need eyes on them at all times. My manager came to me and said, "I am so sorry, but there are no other nurses today, and you will have to have all 4 patients in the ICU." A half hour into my shift, I spiked a fever and started getting sick. I went back to my manager and I let her know what was going on. But again, she said, "I wish there was something that we could do, but there's nothing. If you go home, we have no one." So I was running all day. I was late for medications, late for certain patient cares. It was definitely the worst shift of my career.
Your job for 12 hours is to try and improve that patient's health, even 1%, even 2%. So when you have unsafe staffing ratios, there's no potential for improvement. It is survival. You can literally look at statistical evidence that when staffing ratios are worse, problems become worse.
When something bad does happen, the person who set those staffing ratios isn't the one that's being held accountable. The one that's being held accountable is the nurse that was involved in that care, and the one that suffers the consequence is the patient.
The moral distress that nurses go through, which adds to burnout, is the fact that they leave at the end of the day believing that they didn't provide the care that their patients deserve.
This is Dr. Katie Boston Leary, former Chief Nursing Officer and Senior Vice President at the American Nurses Association. We brought her in to help us break down the realities that nurses face every day.
There's a physical toll in being overworked, but there's also a psychological and emotional toll as well. And those are the things that you don't see. It's a slippery slope between being stressed, feeling burned out, to feeling depressed, and then, unfortunately, sadly, experiencing suicidal ideation. And I'm talking about nurses.
And it's not just the unsafe staffing ratios. The second way the system burns out its nurses is the administrative burden they carry. A surprisingly large percentage of a nurse's day is spent doing things other than caring for their patients.
Charting makes up more than half of what I do in a normal shift. So I have to make sure that I am documenting every single little thing that I do in a patient's room. And if I have been running around all day and my shift is over, I have to stay and chart until I'm done.
We have designed a system where nurses spend less and less time with their patients, which also adds to moral injury. As a new nurse, you go into the profession believing that that's where the joy is, that's where you're gonna spend most of your time. And then when you get saddled with all these additional administrative tasks that takes you away from that, you lose that joy.
Every minute in front of a screen is a minute not spent at a bedside. That math adds up to a lot of patients who needed more care than what they got. The third way is a business model that rewards understaffing. To understand why, we have to follow the money. So we talked to a healthcare administrator to find out how all this works.
My name is Yvonne Lindsay again, and I have been a nurse for 30 years. 15 of that was in an executive leadership role. I believe that burnout's really not about weakness, it's about conditions. And if we want to protect healthcare, we have to protect our nurses. So the challenge is when the financial pressure moves faster than the human exhaustion, that's where you see that huge gap. The system doesn't automatically reward having extra staff for safety, it rewards cost control. So if you're able to have good cost control, you are going to be rewarded for it because now you can say, wow, great job, you were able to manage your budget. But you don't know what on earth was going out on the floor and what these nurses have to deal with in order to make that cost control.
One of the nurses we interviewed saw this exact thing play out on her own unit.
Administration would have 2 surveys to go off of. How were their caregivers doing, and how was the patient's perception of the care that they received? The caregiver scores were so low that they called an emergency meeting, and they came to us and they said, you guys should be so happy. Your patient scores are so high. You guys are doing such a great job. Yeah, our patients were happy, but we were exhausted and we were tired and we were spread way too thin. To us, it felt like because we were good nurses, we were getting punished. And so it didn't matter how the nurses felt. It only mattered that the patients were happy and they were continuing to get the money that they needed, essentially at the sake of the nurses.
The irony is that cutting nurses to save money actually costs hospitals a fortune.
When you lose a nurse that's probably been in an institution for a long period of time, and they have this intellectual capital, probably something that no one else has, because not only do they have the skill sets, they know about the physicians, they know the expectations, and they have relationships. And when that leaves, it takes a long time to replace.
The fourth way is the hardest to quantify, and it didn't happen overnight.
The research from the American Nurses Association indicates that 1 in 4 nurses experience workplace violence.
I had a family member grab me by the collar and threaten me. I've been sexually assaulted by female staff members.
I've been called like I've been called so many different names.
I've had a patient's family member scream at me that I wasn't trying to save their life when I literally was doing chest compressions on this patient for like 3 hours straight.
The violence isn't the only thing wearing nurses down.
During COVID, I felt really undervalued and really unappreciated. To show their appreciation frequently, we'd get pizza parties.
Crappiest pizza in the entire county and throw you a pizza party with the lowest quality cake we can find from a 4-day-old grocery store bakery.
Excuse me?
The nurses are doing the grunt work that's keeping the hospital going. And then to get like this meal or this small bonus when you know that like the higher ups are making millions in bonuses, it's really disheartening.
They weren't offering our staff any incentives for picking up extra shifts, yet they were throwing so much money at travel nurses, where travel nurses would come to our unit and they would be making triple, sometimes quadruple what we were making. It just felt like we were another number. And if we didn't show up, that's fine. They would just find a travel nurse to come take our place.
So, what happens if nothing changes? The National Council of State Boards of Nursing projects that up to 800,000 nurses plan to leave the profession by 2027. None of this happened by accident. It was built slowly over decades by a system that kept choosing efficiency over people. And now the people are leaving. This isn't a resilience issue, it's a design issue, and design issues can be fixed. There are 4 ways the healthcare system is failing its nurses, and there are simple ways to address each failure. Number 1, mandate safe staffing ratios. California made this a law in 2004, and studies show it saved thousands of lives. Oregon followed with its own staffing law in 2023, but the other 48 states still have nothing. Number 2, use technology to cut the administrative burden. There are already AI tools being piloted that listen as nurses document and automatically write the chart. Nurses report that it helps them do their work in a fraction of the time. Number 3, stop treating nurses like a cost to minimize. Every 1% improvement in nursing retention saves the average hospital $289,000 a year. Investing in nurses isn't charity. It's the most financially rational decision a hospital can make. Number 4, build a culture that actually values nurses. Make leadership visible on the floor, not just in emails. Learn nurses' names, recognize their work, treat them like people, not numbers. It costs nothing and it changes everything. Every single person watching this at some point is going to need a nurse. If we don't fix the burnout issue, there may not be enough of them left to take care of us. Thanks for watching. If this video moved you, please share it. The more people who understand what nurses are going through, the harder it is to ignore the problem. And if you work in healthcare or you know somebody who does, we'd love to hear your story down in the comments.